On today's show, we take you to the grand opening of the new Ravenswood Family Health Clinic. On March 26th, the clinic opened its doors in a big fashion. We will show you some scenes from the event and bring you to the complete grand opening ceremony. So sit back, enjoy, and be proud, East Palo Alto.
We've been working for the last 13 years out of a 7,800 square foot modular clinic. We had 67 people working there in that little space. I had a nurse working out of the supply closet. It was very small. We had a tiny waiting area and we had lots of lines. It was very challenging to work there. So this building we have right now 13,400 patients that these are unduplicated individuals who come to our services, whether right now we have medical, mental health, and dental. Here we're going to add optometry, podiatry, we'll add a full pharmacy, and we have larger lab services, and we'll eventually have specialty services.
I think it's fantastic. I really do. It's big. It's something that East Palo Alto been needing really bad, and with the remodeling and everything, and everybody seems warm. And the thing of it is, when you do a medical thing like this here, health center, it's important to give your first expression means a lot. So when a person walk up as a patient, can I help you? What can I do for you? Make them feel good. And when you come into something like this, it makes you comfortable and feel warm, you know?
One of my favorite quotations goes like this. Each of us is called to do something, and if we don't do it, it won't get done. I believe that without Louisa, this would not have gotten done. So let us say to Louisa, thank you for your vision, thank you for your perseverance, thank you for your passion, and thank you for your extraordinary leadership.
I think it's a beautiful thing because people need health when they get sick, like older people. And it'll be a good thing.
Isn't it beautiful? Isn't it gorgeous? There were those who said it couldn't be done. There were those who said you couldn't have a state-of-the-art facility in East Palo Alto. There were those who said hell would freeze over. I'm happy to report it froze over because we're here. We've had extraordinary leadership with Louisa. We've had a phenomenal community board of leaders who believed in this project. We've had a community of donors come together from the federal government, the local government, individual donors to make today happen.
I know for a fact it's a good thing because so many people in this community, they need help from the doctors. They need something like this, you know, especially if they having a hard time, you know, traveling and stuff, where they can't get stuff like this. This is right in the community. This is what they needed.
We built this building with our patients and our staff in mind. So we tried to build a building that was efficient, that it was a beautiful place for staff to work, but it was also a welcoming place for our patients. We tried to design it so we got rid of lines. So we have a queuing system. We also designed it so we could keep people who have appointments to get them in quickly, and those that don't have appointments, we slip them into the schedule, but we would put them in it with someone else who can help figure out where's the best way to put them in.
I think it benefits them a whole lot, you know, knowing that something close by that they can, you know, take their kids to, especially if they ain't got no transportation, you know what I'm saying, or no insurance. So I think it'll benefit the whole community a whole lot.
Anyone is available, but our primary mission is to serve people who have access issues to health care. So people the access issue may be financial, maybe that they don't have insurance. If people are new immigrants or undocumented, they can't get covered California, for example. So they would not have a way to get insurance. Most people who work for themselves don't have insurance. So then we also serve people with mental illness, people who are homeless, people who have language differences, because 85% of our staff are bilingual, either in Spanish or in Tongan.
Bueno, este es un adelanto grande para East Palo Alto porque pues es una clínica donde ya si hay necesidad de que les tomen rayos a alguien, rayos X, no tienen que mandarlos a otros hospitales, o aquí ya va a haber ya más atención y ya más adecuadamente. ¿Cómo de que no? Es un triunfo para esta ciudad de East Palo Alto.
We have what we call a nominal fee of $20 if you're really low income, and but we never turn anyone away if they can't pay. So we will, charge them. We probably only write off about $30,000 a year. People do pay their co-payments and their fees. The County of San Mateo is especially good because they have coverage programs for people who don't have insurance, and so we're able to bill something, maybe not the full amount, but something. Yes.
Lack of coverage and access to medical facilities is a major cause of people using emergency facilities for routine treatment, which comes with high medical bills. This clinic will change that for many of our low-income residents. Patients will enjoy a one-stop shop new facility, making the healthcare experience more convenient.
East Palo Alto has been overdue for something like this. So everybody could come. Anybody.
None of this would have happened without the concerted effort of everyone in this community. Congratulations to Louisa, the board, and each and every one of you.